Man, it's been a crazy couple of months, but I'm back and I'm gonna start making videos again. So this might be old news for some of you who are PTs already and know the latest research about ultrasound. But that's right, today we're gonna talk about ultrasound. And I think this topic is not as controversial as some of the other things we can discuss in the field of physical therapy. So ultrasound and physical therapy. When most people think about ultrasound, they think about diagnostic ultrasound, which is used to check the gender of the baby. In the PT world, we have something called therapeutic ultrasound. Traditionally, you have a wand connected to a machine, and there's like a special crystal. You plug it in, you tune up the settings, the crystal vibrates and you put it over the treatment area. So the idea is the vibrations will cause some type of heating effect on the desired area. And the thought was that it would increase blood flow and improve tissue healing. And this has been used for a long time in the field of physical therapy. Nowadays, due to better research, I think the use of ultrasound has decreased compared to the past. But despite all that, I'm sure you can still find clinics out there who are still using ultrasound a fair amount. Here's the thing with ultrasound. It's really easy to test if it works or not. Set up a basic experiment with controls, test it with it on, test it with it off, and see if you get any special benefits with it. In this systematic review that was done in 2001, the author said, ultrasound has been used therapeutically for over 6 decades. Any clinical significant effects should, by now, have been identified in a number of rigorous studies that have showed which patient outcomes are improved by using therapeutic ultrasound. In our review, we found that it is not the case. Keep in mind that this was done almost 20 years ago in 2001. So 20 years ago, they already figured out that ultrasound is just, it's not the most effective treatment. But let's keep going on. In 2015, another systematic review was done on ultrasound, and let's take a look at what it says. Therapeutic ultrasound did not provide greater benefits than a placebo intervention or device in terms of pain reduction and functional improvement. When provided in conjunction with exercise, ultrasound therapy is not superior to exercise alone in terms of pain reduction and functional improvements. So when you compare ultrasound and exercise, with just exercise, they found that there's not much of a difference. And they found that it's not more effective than a placebo effect. Basically, with it on or off, the effects are the same. You see, after all these years of using ultrasound, we still cannot find much evidence for it. Whether if you're a PT student, a therapist, or a patient, ultrasound should be one of the last things you should be doing in a PT treatment. And for those of you who may already know a little bit about ultrasound and how it's outdated and no better than placebo, you might be thinking, oh, we already know this is old news. But it makes me wonder, why is ultrasound still around? If ultrasound machine manufacturers are still selling these things, somebody's got to be buying them. In my opinion, here are a couple of reasons. Number one, the content on the PT board exam is outdated. I took the PT board exam in 2019, so just last year, and I still have to memorize what ultrasound does and the settings for ultrasound just so I can pass the class and then go on to pass the boards. And I don't blame the schools, because the number one priority of a PT program is for you to go off and pass the board exam so then you can practice. For example, when I learned all that information, the professor was basically like, here are the numbers, know these numbers, but the evidence is not the greatest. Reason number two, ultrasound has just been around for so long. Ultrasound has been like a staple treatment in physical therapy. And because of that, it can be hard to dissociate ultrasound from the field of physical therapy. A lot of times, patients would come in having read some stuff online about ultrasound and they'll ask for it or they'll ask about it. And that's really an opportunity for you to educate. You know, the moral of the story is if your treatment looks like a lot of ultrasound and not much exercise, you're most likely not receiving the best PT treatment. You know, it's called physical therapy for a reason. So more exercise and less of these passive modalities is probably best. I know it's been a while, but I'm back. And if you like this type of content, like and subscribe, and there's more to come.